So most people will get some headache and fatigue and muscle aches and possibly fever after AstraZeneca in the first 24 to 48 hours. And that's expected, and you can treat that with some analgesics or antipyretics. If headache goes away, but then by day 8 you're getting a new onset headache and it's persistent or it's worrying, then you should certainly seek medical advice. If that headache is accompanied by blurred vision or other neurological changes, it's also important. These are clots in unusual locations. The true cases are clots in your head or in the abdomen. And so if you do get abdominal pain or bleeding, particularly skin bruising or little pinpoint bleeding, sometime in that week or two after, again, seek medical advice. Now, the clinicians across the country are very, very attuned and aware now of how to diagnose this. And so screening tests of blood counts can pick up the platelet count, and the College of Emergency Medicine has put out guidelines of how to follow people over time, as well as the Thrombosis and Hemostasis Society of Australia and New Zealand. So there's now very good awareness from the GPs and the emergency doctors. If you turn up and say, look, I've just had this vaccine a week ago and I've got X and Y, they'll put you in the pathway to make sure you haven't got this clotting story. And so it's because what we do know is that the sooner we recognise it, the sooner we can treat it with immunoglobulin and we get good recovery. If you do have AstraZeneca dose 1 and you don't have any problems, then it's important to continue with AstraZeneca dose 2.